In our 50s, hormonal changes start to show in our skin. Moisture is a big factor. We need to keep our skin moisturized because it's starting to thin out. The drier the skin is, the more wrinkles, deep lines, and volume loss show in our face. As a fellow 50-something, I started to notice fine lines, deepening of those creases, and my lips were getting thinner. So I opted for the Kiss lip filler. I got more fullness, more volume in both my lips. Not overfilled, just right. I get my regular Dysport and my Botox for the forehead and around the mouth and the chin. I do the resurfacing procedures as recommended, and I just began the semaglutide injections for weight loss. In my 50s, it's like my metabolism shut off overnight. Hormones, trying to lose the pandemic pounds, I was miserable. I was at my wit's end until semaglutide. And now when I see my friends, there's something about you, Melissa, they say. What is it? Is it your face? Are you losing weight? Are you getting something done? All of it. What is happening to our skin in our 50s? Our skin is thinner and it's less elastic. We don't have the same plump collagen as we did in years before. Laxity is starting to show. Our jawline, eye area, and mouth have more loose skin. This is also due to a loss of fat and bone in our face. In our 50s, wrinkles are at rest. This means when our faces are at rest and we aren't making expressions, those wrinkles are still there. What do we recommend in our 50s? Retain moisture in our skin and get aggressive. Wrinkle relaxers. We want to continue with our regular scheduled treatment of Botox and Dysport. However, we don't want to forget the neck. We can treat the platysma bands, those tight bands in the neck. When we use Botox or Dysport, they appear less pronounced. Dermal fillers. Now that we're experiencing volume loss in our 50s, we recommend Juvederm Voluma or Restylane Lift to add structure to the face. Think of the inverted triangle. We want to keep volume in the upper face. We can treat under the eyes, also called the tear troughs, and this can help with the hollow look that happens with age. We continue to use Sculptra to produce collagen, but we want to combine it with dermal fillers to get an immediate improvement. Lasers. In our 50s, we should get more aggressive with lasers. Our Profound RF, combined with CO2 resurfacing, is the perfect pairing to tighten the skin, erase sun damage and wrinkles. This treatment does include some downtime, but it's worth the time in the results we're achieving. We also don't want to forget about our hands and our chest in our 50s. Sometimes those areas can show our age the most. Anything that we do in our face, we can use on our hands and our chest. We continue to treat with the XPL for red and brown pigmentation in the skin. Our sublative radiofrequency tightens those delicate areas around the eyes and the mouth. We can also treat with a Frax resurfacing every 3 months, or our Resolve, which is great for rejuvenation. Skincare. In our 50s, we simply must be using medical-grade skincare. Obagi hydroquinone will help with brown spots, and Obagi tretinoin helps slough off damaged, dry skin. And don't forget the moisture element. We must use something like Obagi Hydrate to retain moisture. We also love vitamin C and Elastoderm eye cream. Our internal health is still very important in our 50s. We want to make sure we're using the correct vitamins, regular exercise, and an overall healthy lifestyle. Spa 35 can supplement with cool sculpting for fat reduction and semaglutide injections for weight loss. Spa 35 has cosmetic innovations for every generation. Whether you're 30 or you're 60, we can help.